Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please leave your valuable comments. And you can also visit my playlist. In the playlist, I have provided almost all the topics in a very systematic order and you can also make use of it. My dear friends, since last two classes we are discussing about a very important topic in pediatrics, that is nephrotic syndrome. And first we will discuss the contemporary part of the nephrotic syndrome as we are doing since last two classes, and thereafter we will understand what exactly the concept of nephrotic syndrome should be understood in terms of Ayurveda and what is the probable line of treatment to treat nephrotic syndrome in Ayurveda. So that we will see in the coming classes. So today we will continue with the basic information regarding the nephrotic syndrome. And today we'll continue with the pathophysiology of nephrotic syndrome. Now, nephrotic syndrome, basically the involvement is in the glomerular membrane or the filtering area. Okay, so Bowman's capsule and glomerulus, the filtering area of the kidney. In the kidney, the glomerulus filters the blood which arrives to the nephrons. Now we need to understand the basic structure of this, very important. The glomerular endothelium actually consists of following things. The first layer which is present there is glomerular basement membrane, which is also called as basal lamina layer. This is a basal lamina layer. This is glomerular basement membrane. Filtration slits between the podocytes which perform the filtration function. Now these are all the different layers which are present in the filtration area. Okay, glomerular endothelium, what we say glomerular endothelium. So when I say glomerular endothelium, it consists of these important layers. Number one is it contains glomerular basement membrane. Number two, there are some filtration slits are there between the podocytes which perform the filtration function. Number three, it also contains some mesangial cells and matrix which again helps in filtration. It also contains CD206 receptor cluster which effectively filters the blood including the proteins and other ions, and the whole membrane of this glomerular endothelium is basically negatively charged. Okay, it's a negative, that glomerular basement membrane is endothelium is negatively charged, it's a negative membrane, and as a result what happens, those proteins, those particles which is needed to the body with the positive charges, then effectively get absorbed. So this particular negativity of the membrane will not allow these ions to get loose through the filtration. So thus particles only with the molecular weight less than 40,000 daltons are allowed to pass through. Any particle which is more than 40,000 dalton size, so that will be effectively reabsorbed back into the bloodstream. So this is one important thing that we have to understand. Now, the protein which result from increase in the glomerular capillary wall permeability. Now, when there is more protein loss, okay, when there is more protein loss through the filtrated fluid through the glomerulus, so that is called as proteinuria. That is proteinuria. Now why this proteinuria occur? That means the urine contains more amount of the protein than required, than estimated or than expected. Okay, so this is called as proteinuria. So why this proteinuria occur? This proteinuria occur because of increase in the glomerular capillary wall permeability. So glomerular capillary wall or glomerular endothelium, it is very strict in filtration. Okay, so anything more than 40,000 dalton will be effectively reabsorbed. There are podocytes are there, slits are there, okay, some holes are there of particular size. Then we have got the negativity of the membrane is there. So many things are there. So they effectively absorb the protein and in general it will not lose the protein. Okay, let loose the proteins to go. But sometimes there is increased permeability of the glomerular filtration membrane or glomerular endothelium for the proteins, and more proteins passes through this membrane. Now why this more proteins passes through the membrane, exact mechanism is not known, but still we can assume some of the important assertions. What is that? Loss of negatively charged glycoproteins within the capillary wall. Suppose any condition where the negativity of this particular glomerular membrane has been lost. There are many causes that we will discuss later. So that may increase the permeability of the proteins through the filtration membrane. In nephrotic state, whenever we say that nephrotic state, the protein excretion exceeds 2 grams in 24 hours. Suppose if such a protein excretion, because of increased permeability of the membrane to the proteins, if it is more than 2 grams in 24 hours, mainly albumin. Okay, so when albumin, because albumin size is basically, it is less than 40,000, that means therefore the chance of albumin going out is more. Okay, so now in nephrotic state, the protein excretion usually exceeds more than 2 grams in 24 hours, especially the albumin, and that causes hypoalbuminemia in the blood and proteinuria, albuminuria in the urine. Okay, so when edema appears when the serum albumin level falls below 2.5 grams per deciliter. Because of this proteinuria, albuminuria, in the blood, albumin amount comes down. When that albumin amount comes down less than 2.5 grams per deciliter, then usually there will be commencement of the edema. So glomerulus is affected by inflammation or halinization. Now, what causes this permeability of the proteins in the glomerular membrane, increased permeability of the proteins in the glomerular membrane? Although the exact mechanism not known, still in any conditions when there is inflammation of the glomerulus or hyalinization of the glomerulus, this is possible. Okay, now proteins such as albumin and antithrombin or immunoglobulins will pass and appears in the urine because their size is actually less than 40,000 daltons. Okay, so they are more prone to pass through the urine filtrate. Okay, so not only albumin, some of the prothrombins and also sometimes some of the immunoglobulins may pass through the urine. Exact again, why this inflammation occurs in the glomerular filtration area or glomerular epithelium, that is also exactly not known. Okay, that is also not known. So when proteinuria is happening, protein is going out, albumin is losing. Okay, in the blood there is hypoalbuminemia. Okay, in the urine there is a albuminuria, but still the cause is not known. Still the cause is not known exactly. So then we will call that particular condition as a idiopathic nephrotic syndrome. Idiopathic nephrotic syndrome. It is also called as minimal change nephrotic syndrome. It is also called as minimum change nephrotic syndrome. So this type of presentation is very, very common in children. This type of presentation is very common in children. Although they says that it is an idiopathic condition, the cause is not known, but still the immunological cause has been attributed for that. That means there is some immunological injury happening to the glomerular filtration area or glomerular endothelium, and because of that immunological injury, probably this particular damage takes place, and because of the damage the permeability of the protein increases and more proteins are lost in the urine. So this is the most accepted hypothesis regarding minimal change nephrotic syndrome. So in the next class we will discuss more details about minimal change nephrotic syndrome. Thank you very much. Keep watching.